Now to health, where stakeholders have identified vaccine challenges in the country's vaccination efforts, citing storage and funding issues as major obstacles, attributing it to ongoing financial crisis, which has severely impacted the nation's healthcare infrastructure while relying on external support to achieve the required coverage. Director, Budget Office of the Federation, Dr. Taminu Yakubu, disclosed these in an interview during a multi-stakeholders forum on National Immunization Funding on optimizing immunization financing in Nigeria, organized by Vaccine Network for Disease Control, VNDC, in Abuja. Let's join Elizabeth Kasham for more details.
Dr. Taminu Yakubu, who admitted to poor financial vaccine support, says the current administration is working round the clock to acquire industrial capabilities to produce all critical ranges of immunization vaccines to foster the nation's self-sufficiency and discourage importation strategy.
The facts on the ground are not quite positive. The country does not have the industrial infrastructure, storage and logistics capabilities to be self-sufficient in immunization. Two, the current immunization program has over the years relied on external funding to achieve the coverage across the various diseases being covered. Of the $580 million financing need, not up to $200 million is contributed by the Nigerian public sector.
Chief Executive Officer, VNDC, Chika of 4, informed that the forum is aimed at addressing the delays in the release of appropriated funds for immunization and to foster collaboration among key stakeholders.
The parliamentarians, we have people from budget and planning, we have from Accountant General's office, we have from government, Ministry of Health, MPACD, all coming together to develop a strategic approach on how we're going to finance immunization and make it a priority. And we're looking at 3 parts. The funding for 2023 immunization budget has not yet come out, how that will come out. The one for 2024, how that will come out. And lastly, to stop all these things is to see whether we can start to talk about first line charge for financing immunization. And that is something that is very, very exciting. I'm really excited to hear this, and everybody is in agreement with this.
The forum, she said, is part of the Vaccines Network partnership to reach zero-dose children project supported by Gavi through the Global Health Advocacy Initiative. Elizabeth Kasham, ASO Television News.